So my presentation is about the body-mind integrative psychotherapy in treatment of, with stress, anxiety, and depression. I would like to start with my presentation to introduce a little bit more about myself. I'm a clinical psychologist, a psychotherapist, body psychotherapist, and positive psychotherapist. I'm also the international master trainer on body and positive psychotherapy, which is transcultural psychotherapy. I am the holder of World Association of Psychotherapy and the European Certificate of Psychotherapy. I was for 12 years board member in World Association of Positive Psychotherapy based in Germany. And currently also I'm serving as a board member and the chair of the training standard committees in European Association of Psychotherapy, World Council of Psychotherapy. Also, I am an editorial board member in International Journal of Psychotherapy. 10 days ago also I accept the request from the journal from International Journal for Neurology and Psychology, based, I think, in Canada. They asked me to be honorary member in editorial board for that journal. And currently, I'm writing an article. 2 weeks ago, it was published my article in another journal, which is publishing in the UK. It's about body psychotherapy helping with refugees. You know, the situation with refugees are increasing in Europe.
Yeah, I'm just listening.
Yeah, and I was the former lecturer in private universities in Kosovo, faculty member in body-mind medicine, Washington, DC. Also, I'm doing some researches with my students, okay? This is my, what I am currently to know for all of you. Before I want to start with my presentation, I'd like to give some very informative informations about this, my topic about the anxiety, depression, and the stress. So that I try to collect this information from the American Association of Psychiatry and with DSM-5, which is stated that the anxiety is a feature of fear, panic, and phobia. Also, it's a state of mind, which is behavior that have behavior reactions, and state of emotions, which it's also a reaction of the feelings. According to DSM-5, which includes the disorders which are sharing with excessive fear with anxiety and related behavior disturbances. Here includes the fear, a specific kind of anxiety, selective autism, and specific phobia. About the depression, it's also the brain disorder and state of mind, which might have some kind of chemistry of the brain, and also the state of mind, which can have also some behavioral reactions. About the stress, my opinion about the stress is that stress I'm not considering as a disorder, but if the stress is continuing to be in the long way, then might be a cure as a disorder. Because, you know, stress is also a good point, that we need to have the stress, because sometimes stress is triggering us increase our motivation and stimulation. So, but if we are able to manage with our stress, then it's not becoming as a disorder. But when we are not able to manage with the stress and we are not able to cope with that in our daily life, then it might go to the disorders. Some facts, some statistics that are showing the increase of the depression are very in a daily life. It's going more and more, becoming as a acute situations. Some researchers and the results are showing that for instance, in USA, it's affect over than 18 million adults. Also, in the primary reason why some dies of suicide about every 20 minutes, it's the statistics are showing that 41,000 people are every year are dying. Comparing with other disorders, the homicide claims less than 16,000 lives each year. These are some statistics. Maybe our colleagues from USA have very familiar with this, but let's give some information about the Europe. Here are some Europe statistics which are showing that, which are showing that the percentage of people suffering at one time or another in their life from psychosocial troubles that require an external assistance varies between 7% and 50% of general population. If we have in consideration that in the European Union are living between 35 to 75 million people, and these are 500 million residents, then each year 28.2% of citizens in Europe suffer from mental health disorders. Anxiety disorders are suffering 14%. Insomnia is 7%. Major depression is 6.7%. Somatoform disorders, 6.3%. Alcohol and drug dependence are more than 4%. ADHD in young population is 5%. Dementia up to 30% depending on their age. So if we are looking at these figures, these are showing that really the mental health in population are day by day increasing. Today, in the end, I want to talk maybe very briefly to give some my approach from the integrative body-mind psychotherapy about how to cope with this pandemic situation and how to balance our life, which is also I'm considering that this pandemic situation was bring and attach a lot of increasing of stress, anxiety, and depression. But this will be in my last 3 slides that I would like to share. I hope that I will be on time with my presentation. Let's go further. 4 aspects of dealing with stress, anxiety, and depression. These four aspects, it's major aspects that I'm thinking that it's impact all this stress, anxiety, and disorder. And these are central nervous system, especially with the limbic system, hormones, and neurotransmitters. And also physical activities are important, including with the social empowerment and also the spiritual concepts. Why I am emphasizing, highlighting these four aspects? Because if we want to go to the treatment of these topics with dealing with stress, anxiety, and depression, I think we have to have in consideration that these are the complex aspects that we need to have in consideration. So what I'm meaning with this multifactorial aspects, this means that we cannot speak that all these disorders, depression, anxiety as well, and stress, we can see only from one point, let's say only the biological aspects. But also we have to have the support from the psychological aspects, psychotherapeutical aspects, also from the social aspects and the spiritual aspects. That's why I am emphasizing these four aspects of dealing with stress, anxiety, and depression. Have a look at this, my slides, which is my favorite logo that I am using in my integrative body-mind psychotherapy. These are four aspects, which means that in treatment of using with this approach, integrative body-mind approach, we have to have in consideration cognitive level, physical level, emotional level, and behavioral level. These are in this next slide, I'm showing that human being is living in society, and during their everyday life, they have some events which are occurring during their life. So if we are starting from the life events, it may bring the mental level. And from the mental health level, we are also exposing to the physical level. This physical level may also impact to the emotional level. And this circle is going around with all these four aspects. And all these four aspects they are impacting on our body, our relationship, our mind, and our spirits. I use these two slides to show for you how I am using this integrative body-mind approach to deal with, especially with the depression, with anxiety, and the stress. Because I'm considering that all this, if we are not trying to work very slightly with them and going deeper with them, it might cause the trauma. And this trauma, it might be very complexity. When trauma inflicts its deeper wounds into our minds and body, it leaves them feeling hopeless, desperate, and ashamed. And people are wondering, and very often they are asking the question to themselves, why can't I feel safe and calm like the normal people? Using the word normal people, immediately when they feel this kind of wounds, they are not anymore consider themselves as a normal people, because they are comparing the others. They don't have this kind of symptoms, and the person has this kind of symptoms. So they are trying to compare themselves with other people who they think they are normal. But for me, We are all normal. Depends what does it mean for one people normal and what does it mean, let's say, some kind of complaints. Body and brain are restoring of the brain functions and nervous system. Emotion and behaviors are dysregulations and emotional conflicts which are coming from the healing from our past wounds and overcoming harmful behaviors. And also the memory and the trauma, according to the neuroscience, are showing that they can encode itself in our memories, especially in our amygdala, and overwhelming emotions, involuntary shaking, and this kind of dysregulations with our physical movements. In integrative body-mind psychotherapy, I am using 7 pillars, which are uniqueness, holism, healing, partnership, and very special is that while we are treating our clients or our students, they later on they can care for themselves. So self-care are very important. Other healing systems, which can be much more broader. Also the group supports, which I'm calling also psychosocial support, and also, which is very important, spirituality and transformation. These are 7 pillars that are using in my approach, body-mind, integrative body-mind approach. The methods that we are using are self-awareness, relaxation, autogenic and biofeedback, meditation, different kind of meditations, imagery, which I'm considering as a self-hypnosis, a different kind of physical, spiritual, mental exercises, and also the nutrition is very important. And from the spiritual aspect, also different kind of beliefs, which I'm using the prayer. Mind-body techniques can be seen as a relaxation, as a meditation, imagery, exercise, and nutrition. But also in the self-awareness and self-expressions, we are using a kind of stories which are coming from different kinds of books, from journals, or telestories. Also, one of the very good technique, which is only the technique, it's not a kind of specific technique, but it's a very informal techniques that I'm calling drawing, asking from my clients or patients that they have to draw in the paper using the crayons to express their feelings. And in these techniques, I am not asking they to write about their feelings, but only to express by using the different kind of colors with crayons to express their feelings, asking how they are feeling right now, how they would like to feel in the future, and also to draw the way how they should do and what they should do to go to pass from the current situation, current feeling situation, to the next or the future situation. And also movement, some kind of yoga exercises or different kind of exercising, also including the dancing and the music are very good techniques that I am trying to ask with my patients and clients when I'm working with different kind of traumatic experiences. Same with depression, anxiety, and stress. So in this slide, I want to show that, you see, sometimes we have to look in our brain and all functioning of our brain to see and to talk with our brain, which this is a kind of self-awareness and self-expressing to us. For instance, when I'm doing the training or workshops on body psychotherapy, I am using a lot of techniques by walking with staying in front of mirror, or putting a kind of flowers in front of us in the empty chair, and asking to talk and express the feelings, memories to the object, which is a kind of virtual, but I'm much more preferring to put or in front of mirror or a flower, which for me it's virtual, but it's a live object. And as I promised, I think I am on time. So on these 3 slides, I have to show you how it's possible to deal with depression, stress, and anxiety during these days, during this pandemic days. So let's keep this slide about the balance model that I'm using from the positive psychotherapy, which is based on the Nosrat Peseshkian's theory. And this balance model is considering from with 4 aspects. One is the physical aspects, okay, which is including the body and the health. So, which means that how we are taking care about our body and our health. And the second is our cognitive aspect or mental aspect, which is how we are succeeding in our job, in our performances, in our achievements. And the third is how we are making and keeping and building the contacts and relationship, which means these are the social emotional aspect. And finally, the 4th aspect is our belief, our concepts, our imagination about our future plans, which are covering the spiritual aspects. So, and all these are making our quality of life. If one of these aspects are missing, which means this means that we are not in balance. So let's keep all the time care about all these 4 aspects. And according to this, it is very important to see how we are behaving during the quarantine period, when we are in isolation or having a distance, because this virus bring to us that something is very new and break our routine, daily routine. So if we are looking in this balance model, then these 4 aspects about our body, about our health, performances, contacts, and the philosophy of life, then we have the how to protect our physical self. This means that we have to ask the question for ourselves: how I am with myself. So this means that when I am good with myself and I am protecting myself, this means that I will protect also the others. The second aspect is emotional empathy. How I am thinking that the others should be. But first of all, let's think about ourselves. So if I feel good, then I would like also that my dears to be good. So how I am with my dears. The third aspect is social distance, which means that how I am with myself, with my dears, with my friends, and also with my society. And the last is that we need to have respects for all mankind. So this is that how I am with mankind. This very short presentation to show for you how we are coping, managing this situation when we are in this current situation. For this more aspects and the deeper for this, you may find in my web page and in my channel, YouTube channel. So to go for this more deeper to understand these four aspects of having a balanced model and behaving in our. So what to do is that we need to take care of all these four aspects.